So, all right. So here's what we've got. So this presentation is about how artificial intelligence, machine learning is going to shape the post-COVID-19 world. There's a lot of stuff that's going on. We've received a lot of questions from a lot of folks about different things, how their existing models are going to change, what do they need to look at, and so forth. So I would like this to be a little bit open as well. We've got a lot of stuff that we're going to cover for different industries. We tried to make this as general as possible. But if you have some specific questions that you'd like to have me address, we'd be happy to do that. If you prefer to put messages in chat, we'll be monitoring the chat as well and give you as much information as possible. So this presentation, we're going to focus on really four key things. One is how the economy is going to reopen, and just got the information yesterday with some guidance. Each state's going to be different. It's going to be a data-driven approach. We're going to talk to you a little bit about what you should be doing instead of waiting, say, for the governors and for regions to actually act. You can do some of this yourself. We're also going to talk about something that's actually been a little bit, we'll say, unnerving for us, even though we're used to this at 5E, which is the current state of modeling, right? We're going to see a lot of stuff that's going on and some words that are said about models and skepticism. So we want to address that because we think that's important. Then as we move out of the post-COVID-19 area, or as we get into this post-COVID-19 era, we're going to have some challenges. So we want to discuss what some of those challenges are. And then finally, we're going to talk about opportunities in a couple of different areas. This may or may not be the areas that you're in, but hopefully some of it will apply. And as it does apply, you can leverage it. You can leverage some of the ideas. But if you have some specific questions, we'd be happy to answer that. So what's the current situation? As everybody knows, since March 16th, this is a big problem for the US economy, for the global economy. So based on whether your company is global, is national, or just regional, everything's going to affect you, but it's going to affect you in a different way. We're seeing a GDP decline of about 10% over 2 months, which is going to be 3.5 annual decline over the course of the year, about $2.13 trillion in lost national production in the last 2 months. Unemployment right now, we're looking at numbers 15 to 30%. Economists are not too certain as to where it's ultimately going to land, and a lot of that has to do with what Congress does. But more importantly, there's going to be a lot of uncertainty in policy. What opens? Where does it open? What if you get another hotspot? And how does this affect regions and other areas of the country or your business or a particular business? As well as trade implications. If you're looking for materials from overseas, there's going to be significant aspects there. And consumer behavior, and this is one of the things that we're talking to a lot of customers about. Really, behaviors are going to change. The question is, how long will they change for? Some folks have a very short-term memory, so they may not remember the pandemic of 2020. Others will change their behaviors permanently. And that will affect retail stores. It will affect how you handle customers, let's say, in banks. It will affect work situations and work areas, and we're going to talk about some of those. So in the current situation, there's going to be four stages of how we reopen the economy. We're going to continue to monitor virus infections, which we're going to talk about briefly. Identifying the low-risk infection areas. So as the infection rates are lower in certain areas, you can engage in those areas a little bit more, but you have to know where they are. Selected areas and businesses are going to be open. So regions of a state, regions of a county might open up, probably less likely at a county level, but it's still possible. We'll give you an example of where that might be. But certain businesses will have issues. Certain smaller retailers may have issues, but other retailers or distribution, logistics, finance companies may not have certain issues. But they will experience issues in terms of the way they can work. And then finally, there's going to be this cycle of we reopen, we monitor, we identify various cases, and then we isolate either individual or community or even slightly larger areas if it occurs again until a vaccine appears. So what we've done is we've started to model the cases, and some of you who I've been in contact with on this call know that we've been modeling it for quite a while, since really the beginning of March 16th. What we decided to do is we decided to look and slice the data in different ways. And one of the ways was by region. We actually created our own sets of regions based on some other subgroups by the US Census Bureau. And what we find is this is actually going to be very indicative of how the regions are going to open up. The New York metro region obviously has the most number of cases. it is going to be one of the last areas that really opens up in totality. But other areas are ripe for opportunity for opening. So you have your Pacific, your upper Midwest, Rocky Mountain, and then some other ones. And the region order that's here on the right is the order in which the lines appear. So New York Metro is the highest, with Pacific being the lowest. And this is critical because as you're identifying what regions to market in, what areas will be affected by your distribution channels or by your retailers, depending on where you are, this type of information is going to be critical. From a behavioral case, the mortality rates are important because the fear factor of how this affects an individual person's life or a small community is really, really important. This will guide a lot of that localized behavior. New York Metro region, we're reporting lots of deaths, and the numbers changed yesterday because of new reporting regulations. So we're going to have to reevaluate how we look at some of these numbers. But these are the types of numbers that will affect customers. And what's important is to understand in various areas what their belief is going to be about its effect on their localized population, either older population, younger population, or their workforce. So this is what we mean about monitoring virus infections. The data is publicly available, and if anybody would like a feed from us, we can provide that as well. So within our current situation, they're going to have to identify the low-risk reinfection areas. Who is going to have the highest risk of reinfection? How are they going to open up? And everybody's talking about this in a data-driven way, which means as a company, you want to get the data as well. You want to begin modeling this and comparing it to your sales. You want to see and react to the changes and the fluctuations, because the folks are going to respond to, your customers are going to respond to government and policy behavioral changes. And what will happen is that they will have a little bit of a lag from those changes. Then your businesses will have a little bit of a lag from that. So this is a way for you to begin identifying what's happening in the areas. So we think that it's geographical, regional, community-based first. Then it will be by industry and business type second within those areas. And then it will be things that will require strict changes to customer behavior. Depending on if it's distribution, depending on if it's like retail stores, such as shopping aisles that are now going one way. Does this change permanently, where you have this almost voluntary one-way movement of aisles? Do you have a single queue to go into your registers? This will affect the changes of way customers buy, and it will affect your revenue. It will affect your profit line, because it's going to be harder to gauge what the actual effect is going to be, at least in the short term. So you want to definitely model those things. So according to the policymakers, they're going to reopen community by community. What is this really going to look like? Can you predict what could happen? And the answer to that second question is, you can predict with some degree of certainty what that might look like. Is there a risk for more hotspots leading to a closure? And that's a little bit harder to predict, but it is possible at the very least for folks who are in particular areas, who are doing business continuity plans, disaster recovery plans, or if you're looking to mitigate your sales risks, this is something that you want to look into as to which are the hot spots. And they'll be similar to the spots that are currently experiencing the crisis. They will go from smaller to larger. You're going to have to identify the smaller cities in areas that are less populous. You're going to then have medium cities in areas with smaller states, like your Des Moines, Iowa, Omaha, Nebraska, those types of things. Larger cities in smaller states, you might see areas like San Antonio open up. We're still trying to gauge about Dallas, Fort Worth as an example, because we think Texas will be one of the first places to open up. And then you'll have some other areas like North Carolina, South Carolina. South Carolina has been a very interesting case because they've really pretty much locked down a lot, but within the state, there's still a lot of movement. So Charleston, South Carolina could be open for business, and Savannah could be before Atlanta is. Larger, broader populous states will then be last. You will then see this contraction of who's opening, right? Everybody opens up, and so we're getting into smaller and smaller areas that aren't open. The major metropolitan regions that have had their big issues will be the last to open up. Your New Orleans will be last, your Detroit, Los Angeles, San Francisco, and we think New York in total will be the last to completely open. There's a lot of variables that go on into this New York issue. And when we say New York, we're referring to the tri-state area of Northern New Jersey, Connecticut, Long Island, Westchester, and New York City. This is what the map looks like as of 3 days ago. So you can see where the red is. The problem is this doesn't give you the full picture. And the reason it doesn't give you the full picture is because when you look at it at state level, like New York, you can see the disparity that occurs in terms of the number of cases. This is where we think the opportunities are for businesses. If we start looking at these numbers and we can model the decay, which is one of the things that we're doing, that northern New York region is definitely going to see zero cases probably within the next, or new cases probably in the next week and a half. The middle region, probably with the exception of Albany and Buffalo there, again, similar things. You're going to see a real reduction in cases, real reduction in hospitalizations. The downstate area will be a problem. But you can even go further. This is a map to the right of Nassau County. And you can see within Nassau County, there are some specific hotspots. You can see businesses probably in these areas being open very, very, very much last. Whereas other areas, they might be open, and that'll allow the population to disperse their economic activity. We've been talking internally about different things, like with regards to hairdressers or smaller retail shops and so forth. We could see them opening up. We could see them opening up, let's say, in these northern areas where they may exist. Some of these are less populated areas, so they don't have a lot of stores. But you could see those types of things happening. In Nassau County, it's broken up into 5 what are called major towns: town of North Hempstead, town of Hempstead, town of Oyster Bay, and so forth. You could see them probably open up one by one. But the larger congregated areas here in central Nassau will almost certainly be a problem. The other thing of note, and this is something for a little bit later when you're talking to your employees about how to reopen, and we had a conversation yesterday with the American National Standards Institute, is to consider how your employees get to work. One of the things that we noticed in our studies here with regards to New York and California and here Nassau, and it's specifically noticed here in Nassau, this center line here of red is one of the major mass transit areas for Nassau County. It is a popular bus line. This area in red down in the south here, that's Freeport, New York, that also is very heavily trafficked with buses as well as trains. So it's not really surprising to see some of that. Now, the converse to that is these are slightly more populated areas, so that might be a reinfection of the cases. But if that were the case, we should have seen it across the board, and we didn't. So we believe that something to do with mass transit is a big thing. Some of you who've been on calls with me know I've been reporting this. That's going to be a big challenge for New York City. But for each individual company, look at how your employees are coming to work. Because if they're coming to work via mass transit, if you want to protect your employees, maybe those are the employees who really can work from home. People, and if you're doing staggered, people who are coming in will drive first. There are a number of different scenarios that we had a conversation with about yesterday, and be happy to share that with you at another time.